I'm Dr. H. I'm the anesthesiologist that's assisting the surgeon. How are you? Yeah. I know you've been through a lot getting here. I know it's not been easy. I want to reassure you that you are absolutely safe here. This room is where we're going to do the surgery. That door that you came through, that Desdemona brought you through, it leads out to a hallway, goes to a secret entrance from the sewer, and that's locked and guarded and monitored, and absolutely no one who wishes to do you any kind of harm has any idea that you're here. Okay? Alright, you're safe. Now, I'm not going to ask your name for reasons of privacy and, just in case. But I'll call you patient 47, because you're actually the 47th patient that we've rescued from those terrible experiments. We're going to fix as much of you as we can, and then we're going to smuggle you out to a safe settlement up in the northern reaches. I just want to confirm a few things before we get started. You have some rather elaborate body enhancements, and I want to make sure that you agree and I agree, and the surgeon will know what exactly we're making normal again. So let me grab my sheet here. I'm going to make a few notes. So you have the wings. They're really beautiful, but I assume they're non-functional. You can't actually fly with them. Yeah. Do you mind if I just take a... Okay. Wow. Yeah. Some nice work. Too bad they don't function. I imagine they make getting dressed a little difficult, so I figure we can take those off for you. Yeah. Okay. Okay, so you also have a tail. It's a... No need for that. Yeah. Really? I've never thought about having a tail before, but now that you mention it, would make it rather awkward for doing many, many, many things. Yeah, we can take that off for you, no problem. We could just shorten it, if that would help, but no. Okay. All gone. Okay. Okay, so, I don't think there's anything we can do about the facial features, the cranial... Oh, I'm sorry, it's the wings, the tail, the baggage kind of just threw me off. I just assumed that all of that was a modification. My apologies. Desdemona noted that you said you had 2 hearts now. Did you want to go back down to 1, or do you want to? You seem to be doing fine with 2. Might help to have a backup. Of course, probably increases your chance of heart attack. Okay. Yeah. I keep the hearts. I think that's... Keep the hearts. Okay. Alright. Is there anything else that's been done that you would like to have undone? Okay. those things shouldn't be too tricky. They're all external and just gonna lop them off. So, and we'll stitch you up. It'll be easy peasy. Okay. Now, I do need to ask you a few questions to make sure that we can be safe with this surgery, as safe as we can be, operating on you in a secret room in the sewer with, post-apocalyptic conditions. So, have you had surgery before? Yeah, I mean, I know you had the body alterations, but do you remember actually electively going in surgery before? Okay. When was that? Alright. Right. Yeah, no, I'm sorry, we can't put things back in. Even if we could find one of those. Are you sensitive to anesthetic? As far as you know, have you had any reactions? Do you know what anesthesia was used on you when you had the makeover? No? Okay. Alright, well, I'm just gonna assume that that's gonna be okay. So what we're gonna do is I'm gonna give you an injection of ketamine. We don't have anything more modern than that. What that will do is it will induce anesthesia, but it won't keep you under. We use an inhaled anesthetic for that to be safe and protect your airway. After you've been anesthetized with the ketamine, we're going to intubate you so that you don't have any issues during surgery. Because you're going to be lying on your front. We have a massage table for that, so you'll have your face supported. You'll be able to have your face open. But we need to be able to get to your back and your buttocks region to remove the tail and the wings. So I just want to make sure that that's protected. You'll be sedated. You'll be under anesthesia then, so you won't have any recollection of that, but I'm letting you know because when you come out from anesthesia, you may notice that your throat is sore or you have some discomfort, which we can give you some painkillers for. That could be caused by the intubation. Once you're under and we are maintaining the anesthesia with the inhaled anesthetic, we're going to use isoflow and nitrous oxide. Most people know nitrous oxide is a laughing gas, so it should hopefully be, you won't remember it, but hopefully when you're coming out of it, you'll feel kind of euphoric and, okay about the world. And no concerns about having it done. Okay, so the wings and the tail, relieving the two hearts. As far as you know, you're not as sensitive to anesthetic. I explain the process to you. After I give you the injection, I'm going to count backward from 20. And by the time I get to 1, you'll be unconscious, and that's when I'll start the rest of the process. So if I get to 1 and you're still conscious, you'll let me know. Do you have any questions about what we're about to do? Yeah, the procedure will probably take probably 2 hours or so. We need to make sure that we give a good look at the muscle involvement of where the wings are attached, if they're just stuck on there, which they may be since they're non-functional, and we should be able to remove them easily. If there is muscle involvement or they're deeper in your tissues than that, then we'll have to extract them more carefully. That would be more time consuming. We will keep it as short as possible for your safety and comfort. But until we get in there, we're not really going to know how long. But once we remove them, then we're going to stitch up stitch you up. It doesn't look like they're going to be particularly large wounds, maybe a few inches, and they're going to need some aftercare. We'll make sure that the settlement you go to has your aftercare instructions so that you are comfortable and you can have the stitches out when you're ready. Make sure to keep them clean and to avoid infection. So we'll send you off with some clean water for that purpose and some meds for that, and instructions for aftercare. When you're in recovery, you'll be in this room as well. We don't have anyone else scheduled for today, so you'll wake up in this room. You'll be covered with blankets. We may have you on your side, if that's what you would prefer. Probably prefer that to being face down on a massage table. Yeah. Okay. So we'll have you on your side, just so you're not chafing on those stitches. And either I or the surgeon or Desdemona will be here to help you while you're waking up. Okay? Yeah. You're gonna be fine. Yeah. You'll feel much better after we get this done. Okay. Do you have any other questions? I think I covered aftercare. Okay, great. Are you ready? Okay. So first thing I'm gonna do. Oh, gotta take my earrings out. I just got these done a couple of weeks ago. It's my first body modification. A little less dramatic than yours. Take those out. Gloves out today. There we go. Now, I'm going to give this shot to you intravenously, so I need to put an IV in your arm before I do that. Okay, I've done this a lot before, so you'll have a little pinch, but it's not going to hurt too much, okay? Alright. If I miss, you scream real loud, okay? Alright. Okay. Wait. Alright. There you go. Okay, good? Alright. You just hang there. Just gonna take this. Don't move. Put a little tape there. Just to hold that in place. Okay. Now I need to get single dose injection, so the needle and syringe are all made up already. Just gonna remove it from the package. So this is how it's going to work. I'm going to inject this in your arm, and you're going to start feeling very sleepy, okay? You're going to feel a warmth right away in your neck area. It's totally normal. It'll spread down into your chest, down, make you feel like you gotta pee, down to the tips of your toes. And at the same time, it's gonna go up, it kind of almost feels like a head rush, okay? It's all perfectly normal, it's okay, alright? You're gonna feel a little lightheaded maybe, but you're okay. It's perfectly normal. That's what you're supposed to feel like. That's just the onset, the sort of first flush of anesthetic, okay? And I'm going to start counting backwards from 20. And by the time I get to 1, you're going to be fully unconscious, okay? If I get to 1, well, I'll check with you when I get to 1. Squeeze your fingertips, flick your nose, make sure that you're really out. Once I know that for sure, then we'll get started on